Army medic to emergency nurse practitioner. We're going to meet with Cory today to learn why he left emergency medicine and started Mosaic Medicine. Come with me. So, Cory, what was the motivation for making the move from emergency medicine into Mosaic Medicine?
So I think with emergency medicine, what you realized over time is that there's just a lot of conditions that can be prevented by good primary care. That wasn't being done for my patients. So over 15 years of emergency medicine, I saw corporate medicine kind of take over and see the quality of care, the amount of time that doctors were spending with their patients really going down.
And so who are you finding is like the typical demographic or that ideal patient that's seeking out what you do?
I think any patient that realizes that corporate medicine of today is broken is the ideal patient. Men, women, old, young, like they all know that doctors just don't have the time to invest in their health the way that they should.
Yeah, and so services that you offer, it is for both men and women. Maybe touch on a little of that for us.
Yeah, so we're an executive medicine group. So that means we provide executive level primary care, but we subspecialize in men's and women's hormone replacement therapy as well as medical weight loss for our patients.
And I think what we're seeing is an aging population down here in Bradenton, Sarasota area. What are you typically finding is like the age range or the people that are seeking you out? Is it younger people, older people, a good mix of both?
I mean, in reality, I'd say the most common patient population is just older than 35 because we know that under 35, we're invincible, so nothing bad ever happens to us.
Any particular new technologies that you're implementing in here for your patients?
Yeah, absolutely. So a lot of our patients like drug-free alternatives instead of getting surgery and drugs. So we have the latest focused shockwave device called the OmniWave. That's through Gainswave. So that uses focused shockwave technology to stimulate our own growth factors to heal from injuries.
Very cool. And what does that apply to? Like what types of conditions or things are people typically finding that helps resolve or work on?
So right now we're doing a lot of tennis elbow and golfer's elbow. We're doing a lot of plantar fasciitis and a lot of chronic knee pain.
Anything with pickleball? I know pickleball's big and creating a lot of injuries out there.
That's true. So pickleball for those that can't actually play tennis.
Very good, very good. So lastly, what made you choose Bradenton of all places to move to and open up this incredible facility?
So the number one most important answer is my wife, who told me where to move to. All right, but in reality, right, this area was where we were vacationing from anyways, from Northern Virginia. So it felt like every year we were taking 1 or 2 vacations and going to Siesta Key or going to Clearwater. So when we realized, like, why not just live in the place that we vacation, that's why we decided to move here.
What's the difference between traditional primary care and direct primary care that you do as well?
Yeah, so the traditional primary care you think about, people would say that's just insurance-based primary care, right? So you're going to your doctor, you're using your insurance and getting your visit. But like, what are you getting? Number one, you're getting your annual physical scheduled 5 months from now. Number two, when you're sick with the flu on Monday, you're gonna get your follow-up appointment to check in on you on Friday, right? You'll either be better or dead by then, right? And number three, you know that your appointments with a doctor are rushed, right? Insurance companies and government bureaucracies are then running your healthcare. So like at Mosaic Medicine, we don't even have a 15-minute on the schedule because I can't know my patients, interact, and personalize treatment in 15 minutes. But most of a regular traditional doctor's day is spending 15-minute visits with their patient. Here at Mosaic Medicine in direct primary care, I manage 300 to 400 patients myself as my patient panel. Traditional primary care doctors manage 3,000 to 4,000 patients on their patient panel. So direct primary care is important because we are not practicing the same way that people are used to. Right? People are used to just getting that kind of cookie cutter run-of-the-mill healthcare. They've just accepted that that's normal.
Sure.
But we've said like that's not normal. If we find that you taking your car to the mechanic because it's making a noise, you get to spend more time talking to the mechanic about your car than you get to spend talking to your doctor about your health. Like there's a major problem, right?
Agreed.
Direct primary care, unlike traditional primary care, is a low monthly fee. So for us, that starts at $125 a month.
Okay.
That then becomes all-inclusive. So that would cover your annual physical, all of your follow-up visits, all of the visits through the year when you get sick, right? And then you also can receive discounts on other elective services like hormone replacement therapy and medical weight loss, and supplements and nutrients that we offer here in the office. And so in reality, you would not then have to pay anything towards your annual deductible with your health insurance, which for a lot of people can be northwards of, $10,000.
Sure, absolutely. like to thank Cory for showing us around the practice today. I encourage you to check him out on social media, but more importantly, get down here, check him out in person, and until the next time, be well.